How do monosodium urate crystals form in gout tophi? Imagine tiny crystals forming deep inside your joints or soft tissues, causing pain and swelling. That's what happens in gout when monosodium urate crystals develop into tophi. The process starts with high levels of uric acid in the blood, a condition called hyperuricemia. Uric acid is produced when your body breaks down purines, substances found in many foods and drinks. Normally, uric acid dissolves in your blood and is eliminated through your kidneys. But if your body produces too much uric acid or your kidneys don't remove enough, uric acid levels rise. When uric acid levels go beyond its solubility point, which is usually around 6 milligrams per deciliter of blood, the excess begins to crystallize. These crystals are called monosodium urate, or MSU, crystals. They form when urate ions combine with sodium ions in the body. The crystals have a needle-like shape and a specific crystal structure that makes them sharp and irritating. Several factors influence where and how these crystals form. Cooler areas of the body, like the toes or fingers, tend to favor crystallization because lower temperatures reduce solubility. Changes in pH, mechanical stress on joints, and interactions with cartilage or serum proteins can also promote crystal formation. Recent research shows that MSU crystals often start forming through a process involving an amorphous, non-crystalline precursor called amorphous monosodium urate. This precursor initially nucleates, or begins to form, on damaged collagen fibers within cartilage. Over time, this amorphous material transforms into the crystalline MSU form. This process explains why crystals tend to deposit in joint tissues where cartilage is present and damaged. Once these crystals form, they are not just inert particles. They trigger a strong immune response, attracting white blood cells that cause inflammation, redness, and pain typical of gout attacks. As the crystals continue to deposit and the inflammation persists, they can cluster together into larger masses called tophi. These tophi are made up of urate crystals, inflammatory cells, calcium salts, proteins, and other tissue components. They can appear in joints, tendons, bursae, and even in places like the skin or spine. Managing gout involves keeping serum urate levels below the saturation point, usually less than 6 milligrams per deciliter. Doing so prevents new crystals from forming and helps dissolve existing tophi over time. Long-term treatment focuses on urate-lowering medications, lifestyle changes, and diet modifications to maintain this balance, reduce inflammation, and protect joint health. Always consult a healthcare professional for personalized advice and effective management strategies.